Gentleman yields and now recognize Dr. Miller-Meeks from Iowa for 5 minutes of questions.
Thank you, Mr. Chair. And Dr. Walensky, it's nice to see you again, and thank you for testifying before the committee today. And let me just be the diplomat in the room and say that both administrations failed the United States public in its response to the pandemic, and that, in fact, is why we're having this hearing. And thank you, Chair Winstrup, for conducting it and for the questions that you have asked and have posed for us to ask, so that our next response to the next pandemic, which we know is coming, is better and that we're better prepared for it. As you know, this select subcommittee held a hearing in April on the consequences of school closures, in which Randy Weingarten testified as the only witness. She vehemently denied coordination between the American Federation for Teachers and supported the scientific expertise that her union offered on COVID transmission rates among children. Mind you, her experts did not consider the American Journal of Pediatrics findings that showed children were poor transmitters of the coronavirus, or the data from Sweden that showed 0 COVID deaths amongst children aged 1 to 15, despite keeping schools and daycares open for all of the spring in 2020, or the fact that schools were open in Europe, or the fact that there were schools, private schools and public schools, that were open here in the United States. My state in Iowa had reopened schools in August of 2020. And let's not forget the American Federation for Teachers is not a scientific body. The data showed that not only are children poor transmitters of the virus, but they're also, unless they are at high risk, at very low risk for hospitalization and death. The CDC is supposed to be the nation's leading science-based communicable diseases agency, not preventable medical diseases or climate change, although those things are very important, with public health being the #1 goal, especially as related to communicable diseases. At multiple points throughout the pandemic, the CDC issued not only confusing guidance that was seemingly not based on real-world data or evidence, but blatantly false information that fundamentally and permanently damaged people's lives and led to loss of trust. And I, having been a former director of a state of public health, admire your commitment to your agency and your staff. I had the same to my agency and my staff. And I also know how extraordinarily difficult the job is that we do, bringing science into the real world and making decisions and recommendations for individuals to follow. But this occurred in the form and our response to the pandemic and response to lockdowns and shutdowns occurred in the form of mental health decline, learning loss, economic instability, and a loss of trust in some of our premier institutions. And among one of the CDC's pandemic failures was its guidance on school closures. And I understand what you're saying here today was that there were certain things that you declined to act upon with triggers, but there were other things where recommendations were seemingly followed at the CDC's guidance. On February 12th, 2021, CDC issued updated guidance on school operational capacity, which effectively condoned the continued closure of schools, whether it was tacit condonement or implied. Again, this was despite clear data that showed children, especially within elementary schools, were not super spreaders, and that teachers were no more susceptible to infection or death than those in any other profession at which people were working. You also said that you looked and that you wanted to have the most up-to-date data and that it was locally based. And so we wondered, did you use real-world evidence? Was this brought into the bear on what your recommendations were? After the April hearing of Ms. Weingarten, I received a letter from her lawyer at ATF, which amongst other things said that I belittled the scientific expertise that was available to the AFT. He supported his claim by leaking an article that discussed COVID-19 transmissions in households, not schools, and suggested that I keep an open mind and show some humility. Those things have not been previously described to me. However, I'd like to enter these both into testimony. The article by which they are submitting on COVID-19 transmissions in households is from June of this year, so would not have been available as scientific data. So, Mr. Chairman, I ask unanimous consent to enter this letter and the accompanying article into the record.
Without objection.
Dr. Walensky, can you explain to this committee what data the CDC reviewed when developing its school reopening guidance, whether the CDC considered the American Journal of Pediatrics study or data from Sweden or Iceland? And did you consider data and information from school systems that were already open in developing the guidance? And additionally, will you admit that COVID transmission in schools, especially elementary schools, was low enough to not justify school closures?
Thank you so much for that question, Dr. Miller-Meeks. As part of our scientific brief, when we released our, and just to be clear, it was not a document to close schools. Many of the schools were already closed. This was operational guidance to get schools open and keep them open. But in the scientific brief that went along with that operational guidance, we had reviewed publications from the UK, Israel, Switzerland, Norway, Germany, Italy, and more. I can tell you that there was not a lot of published data from Sweden. There was a study subsequently from Sweden that demonstrated that Swedish schools that had in-person learning, their teachers had twice the infection rate as those that had closed. And I can also tell you by late spring that Sweden had overwhelmed hospitals and had ultimately decided to close the schools for people who were over the age of 13. So we did absolutely look at data from other countries as we were doing this. Again, part of the operational guidance, and you speak to what happened in Iowa, but part of the operational guidance was to look at your local community transmission and to say if your local community transmission is low, we really encourage our kids to get back to school. That was entirely the point, as has been noted before. I also want to highlight that the American Academy of Pediatrics at the time supported our guidance when it was released. So we had support from not only public health workers throughout CDC as our guidance. We had done a lot of engagement with our partners and implementing partners, but we had support from the American Academy of Pediatrics. Thank you.
Thank you. I yield back.